Hello everyone, and welcome to the Cardiology Podcast, Why We Do What We Do in Cardiology. In this audio series, we will discuss the practice-changing articles in cardiology from the past to the present. This is your episode for today.
In this talk, I will discuss the main headlines about coronary artery disease in 2023. Just like past years, 2023 saw a flurry of research aimed at conquering coronary artery disease, CAD, one of the world's leading killers. Studies explored various avenues, from interventions like stents and surgery to medication and lifestyle changes. Here's a glimpse into some of the year's key findings. PCI versus placebo, ORBITA-2 confirms relief for angina. The highly anticipated ORBITA-2 trial confirmed what many clinicians already knew: PCI can significantly improve symptoms in patients with stable angina. Unlike its predecessor, which found no benefit over placebo for exercise tolerance, ORBITA-2 showed a clear reduction in angina episodes. While this doesn't necessarily change current practice, it strengthens the case for PCI in managing angina symptoms. GLP-1 takes center stage. SELECT shows cardiovascular benefits. The SELECT trial added another feather to the cap of Semaglutide, Ozempic or Wegovy, a GLP-1 receptor agonist. It demonstrated the drug's ability to reduce cardiovascular events in overweight or obese patients with existing cardiovascular disease, even if they weren't diabetic. This Ozempic effect has major implications for cardiovascular risk reduction, but availability challenges remain. Left Main CAD, Rethinking Revascularization Strategy. The debate around revascularization for left main CAD took a turn this year. Following the controversial Excel results, European guidelines downgraded PCI for low-risk patients with this condition from a strong recommendation to a conditional one. This highlights the need for careful patient selection and risk assessment when considering revascularization for this complex artery. Gender gap in CABG, women demand attention. The ongoing ROMA-Women trial and a panel discussion at EACTS emphasized the need to address the gender gap in CABG outcomes. Women fare worse than men after this surgery, and research is crucial to understanding and bridging this gap. New guidelines, Managing Chronic Coronary Disease. 2023 saw updated guidelines for managing chronic coronary disease. These recommendations incorporate the latest evidence on SGLT2 inhibitors, GLP-1 receptor agonists, lipid-lowering therapy, and other treatments, providing a comprehensive roadmap for clinicians. REPRIEVE, Lowering LDL benefits HIV patients on antiretroviral therapy. The REPRIEVE trial showed that lowering LDL cholesterol with Pitavastatin significantly reduces cardiovascular risks in HIV patients on antiretroviral therapy. This highlights the importance of addressing cardiovascular disease in this high-risk population. BIOVASC, Immediate versus Stage Procedures in ACS. The BIOVASC trial offered valuable guidance for managing patients with acute coronary syndrome, ACS. It showed that immediate PCI was as safe and effective as stage procedures performed later, offering valuable flexibility in treatment decisions. Imaging Wars, ILLUMIEN IV and RENOVATE-COMPLEX-PCI weigh in. The debate around intravascular imaging in PCI saw two important studies this year. ILLUMIEN IV found no significant benefit of OCT guidance in reducing target lesion failure at 2 years, while RENOVATE-COMPLEX-PCI showed advantages for IVUS/OCT in anatomically complex cases. These results suggest a nuanced approach to imaging based on case complexity. DAPT duration, Finding the Sweet Spot. The quest for the optimal duration of dual antiplatelet therapy continued in 2023. A meta-analysis and the updated European guidelines suggested that shorter DAPT regimens may be beneficial in certain patients, particularly those at high bleeding risk. DAPA-MI, Mixed results for dapagliflozin in acute MI. The DAPA-MI trial brought mixed news for dapagliflozin in acute MI patients. While it improved cardiometabolic outcomes, it didn't meet the primary endpoint of reducing cardiovascular death/heart failure hospitalizations. Still, it offers valuable insights into the potential role of SGLT2 inhibitors in this setting. MINT, Exploring Transfusion Strategies in Acute MI. The MINT trial investigated the optimal transfusion strategy in anemic patients with acute MI. While it didn't definitively demonstrate the benefit of a liberal transfusion approach, it showed no harm and suggests further research is needed in this area. Oral PCSK9 inhibitor, a glimpse into the future? The emergence of MK0616, a potential oral PCSK9 inhibitor, generated excitement in the field. This novel drug, if approved, could offer a convenient and potentially safer alternative to injectable PCSK9 inhibitors, further aiding in LDL cholesterol control and cardiovascular risk reduction. Overall, 2023 was a fruitful year for CAD research, bringing advancements in various areas. From confirming the role of PCI in angina management to exploring new drugs and refining existing therapies, these studies pave the way for improved cardiovascular care and a future with a lighter burden of CAD.
Thank you for listening to this podcast, Why We Do What We Do in Cardiology. The information in this podcast is for general information only for medical professionals and is not intended to be a substitute for medical advice from a qualified healthcare professional. We hope you found this information helpful, and we look forward to seeing you on the next episode.